Okay, so hello, hello, dears. Good evening, good day, good morning, good day. Yes, hello again. We are now again about to start for another pre-recorded lecture here in your subject, analysis of urine and body fluids. No, so medyo for the past weeks wala kayo tayo pre-recorded lecture, but now again we're now having another pre-recorded lecture. And actually, we're almost done. Nagyod sa AUBF. Gamay na lang dyan kayo na activities. I think this is third to the last na lang na activities and mahuman na kita. So, di ba, paspas kayo ang SEM. Alright, okay. Alright, so for this particular lecture, we'll now discuss about pregnancy testing. Okay, so yung mga burus dyan, kaway-kaway, mga buntis dyan, mga nagdadalang tao, or nagdadalang tae. Okay, so asa mo ana, nagdadalang tao or nagdadalang tae? Okay, charot. Okay, again, so this is pregnancy testing. So unsay ang importance? Why do we have to discuss about it? And unsa atong role as medtechs in the future? And yeah, unsay ang importance as to why we are again studying or having this activity in our lab. So again, this is pregnancy testing. Okay? All right. So for pregnancy testing, so we'll start first sa yung importance or yung applications in the clinical setting. So first is, of course, it can be used in the following situations. Number one is, of course, wag na mag-isip. Pregnancy testing, it's for confirmation of pregnancy. So, again, nagburos dyan, mga nagdadalang tao, nagdadalang tae. Alright, or yeah, if you want to confirm if someone is pregnant, of course, you perform pregnancy testing. Identification also of pregnant patients, which is quite the same po sa first situation or first rule as to why we are performing pregnancy testing. So we also want to identify pregnant patients, okay? All right, ayan. Next, we also want to, it's not really like the only source or the only test for the diagnosis of ectopic pregnancy, but it helps, okay, in the diagnosis of ectopic pregnancy. Again, we say ectopic, it's extrauterine, meaning wala na hitabo ang pregnancy sa uterus. It's outside of the uterus, usually sa fallopian tubes. Okay, so instead na ma-implant ang zygote sa uterus or uterine wall, wala siya ninaog sa uterus, nagpabilin lang daw siya sa fallopian tube. And dito siya nahitabo ang pregnancy. So usually that's the meaning of ectopic pregnancy. Okay. And evaluation of threatened abortion. So if naay miscarriages, okay, or kanang mga abortion, threatened abortion meaning hapit ma-abort pero wala jud, okay, inana ba? So na-threaten lang siya. Are you threatened by me? Charot, threatened abortion. And last, diagnosis and treatment of trophoblastic tumors. When you say trophoblastic, they are arising from the germ cell. They are arising from the placenta mismo. Okay? So that is why trophoblastic tumors, because these tumors in a way release HCG later. All right. And of course, evaluation po of non-trophoblastic tumors, because there are some tumors na especially na non-trophoblastic, meaning wala sila nag-arise sa placenta, like other types of tumors na mu arise, okay, or mu release po og HCG. Okay, all right. So example of trophoblastic tumors, you have testicular choriocarcinoma, so of course testes sa men, teratoma, seminoma, hydatidiform mole or H mole. So these are some of trophoblastic tumors. Again, they arise from germ cells or they arise from the placenta or the cells that make up the placenta. Muna sang trophoblastic. Okay? All right. And teratoma is example, kana siyang, how could I describe it? Para siyang tumor na like pwedeng na yung mga mutubo na like teeth, pwede hairs, inana, as in it's really weird. Na yung iba na mutubog eyes, inana, but it's a type of tumor, like inana, so teratoma. Okay? Alright. And of course, non-trophoblastic tumors, as you can see, these are types of cancer or tumors na outside of the placenta or outside of the reproductive system usually. Okay, so you have leukemia, lymphoma, cancers of the breast, adrenal cortex, kidneys, and other carcinomas except of the skin. Okay. So again, we'll discuss nga no siyang appeal aning pregnancy testing. Okay. So, what are we testing sa atong pregnancy testing? So, what we are really testing is what we call your human chorionic gonadotropin or your HCG. Okay, so this is a hormone. All right? So, we are testing this because, again, in a way, it would help us evaluate pregnancy. Okay? All right. So again, that's HCG. So you had already your endocrinology sa second year, di ba? So, di na kahit mo elaborate, ani. Kay weakness po na ko ng mga hormones. Alright? Okay, so just a short background lang on HCG. So, HCG is, again, a glycoprotein. It's consisted of, or composed of both an alpha and beta subunit. Okay. Now, for the alpha subunit, so here is an example of the hormone molecule. So you have the alpha subunit and you have the beta subunit. Now for the alpha subunit, it's quite similar. It's really similar to other hormones, specifically the hormones FSH, LH, and TSH. So luteinizing hormone, follicle-stimulating hormone, and thyroid-stimulating hormone. So ang alpha subunit is common na siya, ani na mga hormones, and HCG. So that's why when we test HCG in the lab, example, there is a pregnancy testing, what we test is the beta HCG because it's more specific to the HCG. Okay? And the beta subunit, ani nila, and HCG, muna siya mo confer og specificity nila. Okay? So, again, ang alpha subunit, common silang tanan, but ang beta subunit ang mo confer og specificity sa each hormone. So, meaning, for LH, specific ihang beta subunit, like it's really unique. FSH, unique po dihang beta subunit, etc. That is why also for HCG testing, what we test is beta HCG. Okay? Alright. Ayan. Again, it's first detected shortly after implantation of the zygote. So, immediately gyudayon shortly after. So, pag-implant, usually after pila ka days, mo-rise ang levels sa imong HCG. Okay. Alright. And found in urine, blood, amniotic fluid, colostrum milk, meaning the first milk na mugawas sa usa ka lactating mother, so mga nag-lactate dyan, okay? The first milk na mugawas is known as colostrum. Okay, fetal tissues and nearly all body tissues in a pregnant woman. Okay, so muna siyang HCG. So what is the role of the HCG in pregnancy? As I've read, ang HCG manggod kay it allows or it prevents daw the regression of the corpus luteum after implantation so that magpadayon dyan pong release og estradiol and progesterone ang corpus luteum so that ma-maintain ang integrity, okay, and magpadayon ra pod og grow or magpadayon ra nourish sa uterine wall, okay, which is really important samot na kay bago rang na-implant ang zygote. Sumunod na siya purpose sa HCG. Okay? Alright, so yeah, that's again. Remember lang yun na nasa alpha and beta subunit. And the alpha subunit is common with other hormones such as FSH, LH, and TSH. Okay, so that is why we don't usually test for alpha subunit. If you really want to be specific for HCG, you test for the beta subunit. Because again, it's the beta subunit that confers specificity for each of the hormone. Okay? Alright, ayan. So again, that's your beta HCG. Okay. HCG is made again by cells formed in the placenta. Specifically daw, the syncytio trophoblast. Ayan. Syncytio trophoblast cells of the placenta. Okay? Alright. Ayan. Levels can first be detected by a blood test 11 days after conception and 12 to 14 days in a urine test. So it's really quite bag or good. Usually after 2 weeks daw, mo-rise na ang levels ng HCG. Okay, alright. And it will double every 72 hours. And the level will reach its peak in the first 8 to 11 weeks of pregnancy. That is why if pangutanon mo, what is the highest peak or when is the highest level of HCG? It's in the first trimester of pregnancy. Okay? At the first trimester. So meaning the first 3 weeks. Okay? 8 to 11 days. Okay, first trimester. Yeah, first trimester of pregnancy. Muna siya highest peak, highest levels of HCG. Okay? Alright. And after that, usually mo decline na siya as, you know, as other hormones start to take part in the development of the fetus or of the embryo. Okay? Alright. So, that's the HCG. Again, a alpha beta subunit, unsay highest peak niya, o when is the highest peak recorded? First trimester of pregnancy. Okay. Alright. So, we now go to the methods of pregnancy testing. So, again, all of these, ang gina-detect na good is HCG. Okay, and there are a lot of methods for testing pregnancy. Okay, first one is bioassays. Okay, usually muna siya yung first type of tests na use, okay, to detect, you know, for pregnancy testing. Okay, ang bioassays. Next is chemical pregnancy tests. So we test, okay, using mga reagents and chemicals. Third is clinicians or clinical pregnancy test na ay murag injection injekan ang bayi ani later. We'll discuss about that. And last is your immunoassays, which is the more common tests nowadays because there are POCTs, right? Point of care testing for pregnancy testing. And it's much more convenient and easy to perform ang immunoassays. Okay? All right. Ayan. Okay, so we'll start first with the bioassays. When you say bioassays, it employs the use of live animals. Ayan, use of laboratory animals. It could be in the, So again, laboratory animals, and what you do is you inject the animals with the sample. Example, the urine of a pregnant woman, inana. Okay, and then we inject it to the animal, and then we observe for positive reactions depending on the test. Okay, all right, ayan. So, the classic pregnancy bioassay formats, there are different types. Mugamit either tag immature female mice, okay? Immature female rabbits, immature female rats, and pwede pong frogs or toads as test animals. Actually, in the real lab yun unta nato, lab activity nato, mugamit ang frogs. Okay, so sadya po unta ni na activity because again, kaboy mo collect sa yung frog, and then, or toad, okay? And then, ato na siyang injekan o ihi sa pregnant woman, and then natay observe. Okay, so sadya agad na siya na lab activity sa AUBF. Okay, but yes, sayang naman. Sige lang. Okay, all right. So again, this is bioassays. When you say bioassays, it employs the use of live animals, or they employ the use of live animals. Okay, all right. So we'll now start with immature female mice as test animals. Ayan. So si mice. So we have the Askeim Zondek. Okay, for Askeim Zondek, we use again immature females about 18 to 21 days old, 8 to 10 grams, 0.4 ml of urine. Okay, so 0.4 ml of urine of a pregnant woman is injected subcutaneously to the dorsal limb. So dili mo siya i-inject. Okay? All right. And then incubation period is about 100 to 120 hours. So you incubate first para mo effect that para na-time mo effect ang let's say HCG na present ba sa ihi sa imuhang patient, okay? All right, the positive reaction is enlargement of the ovaries. So, wala naman nag-perform. Again, katurang frogs ang mag-perform. But I believe, kaya since enlargement of ovaries man, you have to cut the animal open to check if ni enlargement ovaries, I think. So, loy kay si mice, right? Okay, so mga animal cruelty. Okay, anyway, all right. So again, positive is enlargement of ovaries. Yes, okay. And the presence of red spots sa imuhang ovaries or corpora hemorrhagica. So if na mga red spots sa imuhang ovaries and enlarged siya, then therefore it's positive for this reaction. So meaning ang ihi sa imong patient na HCG. So pregnant siya. Na correlation. Okay, all right. And naman po yung presence of yellow spots, corpora lutea. Okay, all right. Ayan. Okay, next, immature female rabbit. So ba cute ka siya. Okay, so ato na siyang i-test. Atong gamiton, we have two types. You have Friedman's test. Immature females ang gamiton. 15 ml of urine is injected to the marginal ear vein. Okay, sa ears ang i-inject. And then incubation period is mas 30 to 48 hours. So medyo short lang, mga 2 days. Okay? And we have the Hoffman's test. Immature females pa rin, same requirements. Pero it's 5 ml of serum this time, dili urine. Ang inject sa imuhang marginal ear, and incubation period is quite shorter, 30 to 40 hours. And the positive reaction is hyperemic uterus. When you say hyperemic is increased blood flow, okay, to the area. So example, increased blood flow to the uterus. So what happens na ay mured ang uterus or muswell siya. Okay, so hyperemic uterus. So still the same, I think you have to cut the animal open to examine this positive reaction. Okay, so hyperemic uterus. Okay. All right. Next, after the rabbits, we now go to rats. Okay, all right. We have two tests pa rin. You have Frank Berman's test. Still the same, immature females. 5 ml of urine is injected subcutaneously, and the incubation period is about 16 to 24 hours. And we have the Kelso's test. Immature females, 4 ml of urine na lang this time. And then incubation period is about 1 day. Okay, and the positive reaction is hyperemic ovaries. So katong sa rabbit, hyperemic uterus, this time it's hyperemic ovaries. So again, mo red ba ang ovaries or muswell? Because again, when you say hyperemic, increased blood flow to this particular area or particular organ. Okay, in this case, the ovaries. Okay, so again, still the same. I think you have to cut the animal open pa rin to examine this reaction. Okay, all right. Ayan. And next, we also have the Copperman's test. Immature females, 4 ml of urine is injected intraperitoneally. So, there is sa iyahang ilalong peritoneal. Okay? Intraperitoneally. Okay? And then, 20 to 24 hours incubation period. Positive is still the same, hyperemic ovaries. Okay. All right. So, after the first types of animals, we now go to the, frogs or toads. Ayan, si Xenopus laevis. Again, this is the type of test na to i-perform sa lab. Unta, sa ato lab activity. Okay, you have the first one is Hogben's test. It uses a female African clawed frog, Xenopus laevis. So we set aside the frogs first for 8 to 12 hours. We inject 2 ml of urine in the dorsal lymph sac. I think diri to dapit gi-inject, dapit diri sa kilid nila. Okay, incubate again for 8 to 12 hours. And the positive result is oogenesis. So meaning mo ovulate siya or mo create siya og mo create siyang eggs. Okay? So, ni-ovulate siya. That's oogenesis. Okay. Alright. And, yes, this one is what we will perform, Jude, in the lab. The Galli-Mainini test. This is, again, what we should perform sa lab, Jude, in the normal setting. But I believe, since wala man, maybe we could provide a video for this. Okay, so if napay time, yes. So, we'll demonstrate how to perform. So, what we do is we use a male frog. We use a male frog. Kaning common tone is either Bufo or Bufo americanus. So, sadya ikaw kamoy mo collect sa frog. And then, daghan mga, I have friends who are really kanang frightened sa frogs. So, kami itong ni-collect ato. It was really like sadya gito siya. Although medyo kapoy siya pag-collect. And as well as a pag-perform sa test. Because again, frogs are quite energetic. They're quite kanang daghang movements, alright? So, easily agitated sila. So, dali silang mulukso, alright? So, again, this is the Galli-Mainini test. We used male frogs. Kabante mo sa previous tests, what we used were female frogs. But this time, we use male frogs or toads. Okay. Ngani common kaayo ni daghan ni sa among balay sa likod. Okay. I know, common ni siya, mga common toad. Okay. Alright, so for the procedure, still the same. We inject 2 ml of urine in the dorsal lymph sac. If I'm not mistaken, I think diri siya dapit sa iyahang diri siya gi-inject. Yeah, of course you use a syringe. Okay, 2 ml of urine of a pregnant woman. Okay, all right. Ayan, and then we incubate for 30 minutes to 3 hours again to give time for the HCG to react. Okay, within the toad's body. Okay, and then collect urine samples from the cloacal opening of the frog. And then, using a Pasteur pipette, and then we place 1 drop on a slide and cover slip and then examine under the microscope. The positive result is spermiation, meaning mo create siyang sperm. Okay, alright. So, ako na ibalik siya po na picture sa frog. Okay, so example here, the frog, na siya iyang lubot, ay kadidere, paskan mo na siya Pasteur pipette. As in, like, very invasive yun siya na procedure for the frog. Luoy kayo. Imo siyang paskan ng Pasteur pipette after incubation. And then, what we do is, kaning sa ilalom niya, amo siyang gitikon kay para mugawa siyang ihi diri sa cloacal opening. Okay, so imo siyang paskan og Pasteur pipette. Like katong yung mouth sa Pasteur pipette. Imo siya ipasok sa butt or sa cloacal opening sa frog, and then you wait for a urine. Usually pagpasok nimo sa Pasteur pipette, if ever taas ng incubation na ay murag ihi na kana pagpasok jud nimo na ihi na musulod sa Pasteur pipette and muna siya mo examine under the microscope. But if wala, that's what you do. You tickle imo siya i-tickle sa ilalom kani. Diri dapit imo siyang gitikon there. And then mo release na siya ihi. Nay uban daw sa ubang sections sa among time na like nagdugo na jud daw ang cloacal opening sa frog. Kay intense kaayo ilahang pag sa Pasteur pipette. See, if intense na kaayo guys, mudugo gyud siya. Samot na first time. Charot lang, joke. Okay, all right. So again, that's for the Galli-Mainini test. You collect the urine from the frog sa cloacal opening. And then we put 1 drop sa imuhang microscope slide and examine under the microscope. And the positive result is spermiation. So here's an example of a picture. Ayan. So that's the injection of urine into the dorsal sac. Okay. And this is the positive result, spermiation. Ang describe niya sa sperm is banana-shaped sperm. Ayan, as you can see, mara siyang banana. Alright, so muna siya positive. So meaning positive for the presence of HCG sa urine sa pregnant woman. So pregnant siya, meaning na siya HCG. Okay, that's a positive result. Again, that's for Galli-Mainini. Again, although these tests are still studied about karon sa atong lab, but again, these are all obsolete. Usually, wala na ito na gina-perform. Because again, number 1, it's too invasive and too cruel put for animals. I mean, like, yeah, you have to cut open maybe the mice and rabbits. And then for frogs, pag you have to make tusok their cloacal opening. So it's very masakit talaga. So we don't perform this anymore. Char. Konyo. Okay, so again, bioassays. These are, again, quite obsolete na. They're not performed in the routine clinical lab. I mean, imagine na, like, mag-intern mo sa Soto or Galyares, na paslay frogs dito. Okay, not anymore. Okay, so again. But these are the first types of tests that were invented to detect the presence of HCG in the urine of a patient. Okay, all right. Or para for pregnancy testing again. But again, these are not performed anymore in routine lab. They're quite obsolete methods na. Okay, all right. So for the next part of the video, okay. We'll go first with our false positive results of frog toads. Of course, first is high titers of pituitary gonadotropin. Because again, the pituitary can also release HCG daw. And gonadotropin, it could cross-react also with our intended analyte, which is HCG. As you can see, they're quite the same. Gonadotropin, so quite the same ilang structure. So they could cross-react. Okay. Drugs such as chlorpromazine, phenothiazine, derivatives, and aspirin, although, again, maybe that could cross-react with the reaction or can stimulate, okay, the production siguro sa frogs of like ovulation ba or spermiation. Ovulation induced by handling, so meaning kanang na-stress siya, because of na-stress siya sa environment, naka-produce nun siyang egg. So therefore, na-false positive. So it was not caused by the HCG found in urine, but it's because of the handling of the examiner. Okay, all right. Spermiation induced by epinephrine in the urine. So example, patient mo kay agitated, like katunggikan kung asa tong ihi, di ba? Like example, na-agitate siya, so nag-release siya epinephrine sa ihi, or maybe napon siya gina-take na tambal na epinephrine. So if na-inject siya sa frog pod, that could induce ovulation ba or spermiation, which is not caused by the HCG na. So it's false positive. And in incomplete abortion, when you say incomplete abortion, manggod. Okay, incomplete abortion. So therefore, naadya po'y ginagmay na HCG levels, okay, sa ihi sa imong patient. So therefore, pwede siyang maka-induce gyapon of, spermiation and ovulation. Like example, ni kuha ka og urine from a patient na dili pregnant, let's say, and then ni undergo siya in abortion. All right. So maybe if incomplete abortion, there are still some levels of HCG found in the urine that could have induced these ovulation or spermiation sa imong frogs. Okay. And for the false negative, low sensitivity of test animal due to seasonal variation. So example, the frogs have been experiencing, example, mga stress or different mga environments that they were subjected to in the nature, in the environment yun. So na mga seasonal variations that could affect also the test mo ng false negative. Alright? So maybe dili sila kayo reactive sa HCG na naa sa ihi, okay? So munang wala sila nakaproduce og sperm or eggs, okay? Alright. Low titers or concentrations of HCG. So what we do is we concentrate by extraction or absorption with kaolin. So example, early pregnancy pa lang, bago pa nag-start ang pregnancy. So wala pa kayo ni taas ang HCG levels. So you want to increase the concentration, we do concentration or absorption by kaolin. Okay. And toxic urine specimen detoxify by dialysis. So example, kanang may mga kidney failure na patients, wala na detoxify. So that could alter the production of the sperms or eggs by the frogs. Okay, so those are some of the false negative results. Okay, and of course, alkaline urine, due to bacterial contamination, you acidify the pH with HCl. Because again, if alkaline ang urine, maybe the HCG could have also deteriorated na, okay, na decompose na siya. Because again, alkaline na ang urine. Although, so kailangan siya ibalik sa medyo acidic na pH, okay, para ma-maintain ang integrity sa imong HCG. Okay, so if alkaline na siya, so pwede na deteriorate, so therefore, dili na po siya ka-induce og spermiation or ovulation sa imuhang frogs. Okay, alright. Okay, ayan. So causes of toxic urine, example, excess amounts of electrolytes, particularly potassium. So kanang usually dialysis patients, diba? So they need to really detoxify their blood. Okay, so muna mag-dialysis sila para dili sila ma-intoxicate sa ilang mga waste products. Okay, bacterial contamination and toxic substances, of course, because of mga byproducts of bacterial metabolism, and also mga toxic substances that the patient have ingested ba or na-expose ba ang patient to, and the presence of salicylates and barbiturates, which are some medications put. Okay, all right. So those are some example or causes of toxic urine. Okay.